I have with me Professor Halberthal from Rambam Israel's Health Care Campus. And we're grateful to have you on the show. Professor Halberthal, in light of everything that's going on in Israel, we're cognizant of the fact that you healthcare professionals are bearing an enormous burden. Could you tell us a little bit about what it's like as a healthcare professional in the midst of this terrible crisis?
First, thank you, Chris, for having me. Yes, since Saturday, we are under horrified event, and that mostly happened, we are located in the north, mostly happened in the south, but as Israelis, we are all extremely involved. The healthcare system in the south were overwhelmed with hundreds of casualties. And you can see the numbers of 1,200 people that were murdered, almost 3,000 people were injured, and somewhere between 150 to 200 people were kidnapped. Elderly, children, and everything. So, and obviously, as being a small country, we are extremely in touch with our colleagues in the south, and the things that they have to do and the things that they saw is overwhelming. Rambam by now received about 48 patients out of the south that were secondary triage to Rambam. We still have about 13 of them hospitalized, and no doubt that the event as on the medical side was extremely challenging and extremely emotionally and needed lots of strength to deal with.
Now, we just read news reports that many people in the north are evacuating and the conflict may be heading your way. Your hospital is uniquely prepared for such events. As we see the missiles striking and buildings being targeted, we know that Hamas and these other bad actors target hospitals just to create confusion. How does a hospital like Rambam prepare itself to handle the influx and prepare yourself and defend yourself from these attacks? How do you guys do that?
So this is an aftermath of the war that we had in the north in 2006, where at the time, the Second Lebanon War with Hezbollah missiled the home front. This was the first time that the home front was basically under attack. And Rambam, as being the tertiary care center, level 1 trauma center in the north, located in Haifa, we had missiles falling around us, about 70 missiles. Now, at the end of the war, at the time, obviously, none of the hospital was fortified. So at the end of the war, we as management decided that this cannot happen again. This cannot happen, that we will have a problem giving medical care to the citizen. This is our commitment. And I think that what you'll see is coming out of this commitment that we have to treat patients in all scenarios. The solution that we have made is took two issues that we had at the time. First, as we said, the fortification. And the second one, there was a huge problem of parking in the area. So we built an underground facility, 3 floors. Each floor is about 5 acres. That on regular days, it's a parking lot. But in case of emergency, like military confrontation, it transforms to the biggest underground hospital in the world of 2,000 beds, the Sami Ofer Underground Hospital. And the basic idea is that Rambam is 1,100 bed hospital. And in case of emergency, we have to supply a surge capacity for 1,400 patients. And basically all the hospital, all the patients, the staff, and even families are going to be treated in an underground facility, basically deserting the hospital above ground. And all of that will be protected basically for conventional war and even for unconventional war. So this is an immense facility that gives all the solutions, and basically we can work without any help from the outside for 3 days.
Wow, now that's an incredible achievement, and we compliment you on your preparedness. What a terrible place to be in. This particular conflict, we're getting reports here, is different than some of the earlier ones. That Hamas is going through the territory, killing and maiming unarmed civilians, grandmothers, children, families. Yesterday, we had a report 40 babies were found, some of them beheaded. Surely this is an escalation, and doesn't that present particularly vexing healthcare problems to the healthcare community? How are some of your people, your colleagues in the South, reacting, and how are they dealing with the mass carnage?
It's no doubt extremely difficult. It really hurts your soul. First, we were caught by surprise, and obviously, as proud Israelis, it's not simple even to absorb this event and the effect of the event. The horror story that you hear, and you beheaded children, raping women, and killing elderlies and children and full families. 1,200 people were murdered. There was a big party, peace party in the South, and there was a massacre, just a massacre. Around 300 people were murdered over there. Young people that came to have fun, to party, and without any remorse or anything, just animals. No, I cannot, I never talked like this about people, but seriously animals. And we were so moved to hear the President of the United States yesterday, President Biden, talking about the event, talk about America and their response to the event. It was, for me as an Israeli, it was extremely emotional to hear him talk and giving us the support. And we know that the American people are giving us the support physically, but also in words and in many other things. I think it's, for us as an Israelis, it's extremely important, this support that we get.
Well, we appreciate the government getting involved as well, but our viewers and our listeners, we understand there's a way for us to actually help directly the Rambam Hospital. And we're going to put up a link here on our website and send it out to all of our 3 million subscribers. We'd like to know just a little bit, as we contribute to Rambam Hospital, what can we do and what will the funds be used for?
So obviously the needs are immense. When you prepare to an event like this, it's all the underground hospital, we need huge amount of equipment for emergencies, and that we will be able to operate during this time. We are preparing, because of the event in the South, we are preparing for another 4 operating room urgently with all the equipment, and you need lots of intensive care beds. Again, if this will happen in the north, meaning going east, the northern part of Israel, attacked by the Hezbollah, one need to understand that also in the south, the Hamas has rockets, but they are more crude rockets, simple rockets. The Hezbollah has much more powerful and accurate rockets. Just to give you an idea, we are expected, or our reference scenario is that we have to accept a war of 35 days with missiles falling around us every 4 minutes, 35 days. And obviously, this is a huge challenge to any medical system. So all the help, first, your support, extremely important, but all the help that we can get, it will be extremely appreciated.
Well, I'll tell you what, I'm going to encourage each of the viewers here on our screen that are watching us live during our show on Thursdays, but also in syndication. These needs don't go away. please contribute to the link on our screen and make sure that you help out the Rambam Hospital in their time of need, knowing that your funds are going to directly help people in Israel. Dr. Halberthal, thank you so much for being on our show today. Now, we're going to stay tuned with you and follow up with you in the week's future, and anything else that we can do for you, you please let us know. Thank you, Dr. Halberthal.
Thank you, Chris, and thank you for the audience. It's overwhelming and for me to hear your support, and really it's so moving and touching. It gives us the power, and we will win at the end.